Yes, good morning, everyone. Always happy to have Sigrid on our call.
Hello.
Hello and welcome. So, to preface this, we have Sigrid in a bit of a precarious situation because she's got hacking works going on around her. So, we might have to switch to a plan B a little bit later on, but let's keep our fingers crossed that everything is going to remain quiet.
Yep.
Our topic this morning, dear mummies who are joining us as we speak, we're talking about all natural remedies and healing that is a little bit more gentle on our small bodies, on our babies, also gentle for pregnancy. So we'll talk about natural healing modalities for all kinds of life circumstances. But I think I'd like to start by introducing Dr. Sigrid. So, Sigrid, you're a beautiful naturopath. Oh, also bilingual. I think we should, trilingual in a way, because you speak French, German, and English fluently. So that is really good news for our expat mummies out there. Talking about health is sometimes a little bit daunting because we don't know all the jargon and the medical, the things. So it can be really helpful to talk in your mother tongue. But so you're a beautiful naturopathic doctor. You're trained in Canada. Tell us a little bit more about your training and what you learn in your training, because there's a difference, obviously, in someone doing a diploma versus what you did in Canada.
Okay, sure. Hi, everybody. Just to all of the participants here today. It's nice to be with you today. So yes, a little bit about my training. So I did my naturopathic training in Canada. So in North America, the world of naturopathy is quite organized compared to some other countries, although they're also not fully there yet, I guess, in lots of ways. But the way the training works there is that you have to have done a bachelor degree in science, and then you can move on to the naturopathic program, which is a 4-year full-time program. So it's a lot of the parts are very much like a pre-med program where we do, our human physiology, anatomy, biochemistry, like all this science. And what they want to do is to train naturopaths that are able to diagnose illness in the same way as a medical doctor would, recognize red flags. So if there is, a reason to be on a prescription medication or see a specialist, we are trained to recognize that and send them out to see the right person. But ideally, the person is dealing more with either a benign condition or a chronic condition that they're generally trying to manage. And that's where naturopathic medicine really shines, because we can then, instead of just putting a person on a prescription drug and that's that, we actually try to help the person put all of the fundamental building blocks of health back in place, which can be related to sleep, diet, exercise, and also all of our therapies like botanical medicine, homeopathy, hydrotherapy, nutrition. So we really look at the whole person. Yes. And see where there might be gaps that may then help improve maybe the immunity or deal with a long-standing condition. So that's the goal of the training. So I did that in Canada. That was about 16, 17 years ago now. And I've been practicing ever since. And I see a wide range. It's quite a family practice. I see mostly women, but I do see some men too. Lots of pregnant moms, lots of children. So we can apply the principles of naturopathy across individuals and conditions.
Yeah, and I love that. And I love that too. You're a part of a holistic practice. You are with other doctors. You have that kind of feedback to all the testing facilities and so on that many people don't have. So I think that's good to complement your practice as well, and to speak to, conventional medicine doctors, and then you talk about your natural modalities as well. Anyway, I'm going to dive right in, and as always, mummies, this talk is all about you. And so if you have any questions that are burning, I would really like to give you an opportunity to speak directly to Dr. Sigrid. I will start by talking about pregnancy, because often our talks are more geared towards moms with kids, but I find that naturopathy in pregnancy, a lot of moms find themselves faced with illness, that normally they know how to treat, but then they have the flu, they have COVID, whatever it is. Even doctors are hesitant to give them medication, the medication that they're used to having. So it's really good to know that there are alternatives out there. So what do you usually, like, how do you deal with pregnant moms? How do you work with them? Do you work with them for flus and colds, and what are the modalities that you have there? And then there are obviously specific pregnancy elements as well, that maybe a GBS treatment, or moms who have gestational diabetes. How do you work with them? So what are the kinds of things that you see in pregnancy usually?
So usually when I see pregnant moms, I will accompany them for the whole, duration of their pregnancy. And basically each trimester, right, has its own set of difficulties when it comes to symptoms. So, we see, for example, in the second trimester, there are a lot of issues typically with constipation. Second and third trimester, we see a lot of muscle cramps, which disrupt sleep further at night. In that, of course, towards the end, we have some cases of GBS, and sprinkled, peppered on all of that, we have colds and flus, COVID now that has come along. And indeed, all of these things are, which is great, are relatively benign. So they don't usually call for heavy duty prescription medical treatment. But we are really cautious in pregnancy. So even some of our over-the-counter products are not necessarily recommended. Yeah. So, pregnant moms are sometimes left with not that many tools to use, or we're left with Google. And Google can be a little bit extreme in the other direction, where if you listen to Google, like, everything is unsafe, including tried and tested herbal medicines that we've used in pregnancy for centuries in Europe, So for colds and flus, I would very often rely on our basic vitamins and minerals. So the classics to support immunity are ensuring that vitamin D status is adequate in pregnancy, and same with iron status. So I will often ask pregnant women to check these nutrients somewhere in their second trimester if they haven't done it earlier. Just because if those levels are kept adequate, immunity tends to be much stronger. So we are doing prevention, essentially.
And can I add here that iron is poorly understood, is, in my humble opinion, by most gynaes out there. So what I find is they typically only check your hemoglobin. They don't look at ferritin necessarily. Your hemoglobin is only so much of the picture. But often they say, a ferritin level of 20, that's, adequate. And it's really not, it should.
Especially in pregnancy.
Absolutely. Yeah. So I think, and lots of people don't know, though, that low iron goes hand in hand with low immunity as well.
Yes, and I find gynaes in general, that's not, nutrition really isn't their area of training. And so it's definitely not a priority for them, right? They're very good at dealing with life-threatening issues and do that very well. But the preventative side and the nutritional adequacy side really isn't their jam. And so often what they will do is in that first blood test in pregnancy, they won't test nutrients, they will test other important things like infectious factors and so on. But our only indication at that time of a woman's iron status on the blood test will be their red blood cell count and hemoglobin. And this may look completely normal when in fact there's already an iron deficiency, because it's only when your iron has dropped to a certain level that your body's unable to make red blood cells anymore, and go into anemia, which is when gynaes would start paying attention. And so if women can have their ferritin, which is their storage form of iron, tested early on in pregnancy, for me that's useful information, because then we can work on replenishing that through diet or supplements before it starts to plummet anyway in the third trimester for most pregnancies. The other thing is that when we want a woman's ferritin to be as adequate as possible, which for me, I would say 40 and above is fine. There's a bit of a gray zone there. Some practitioners really want to see it a lot higher than that. I'm happy with 40 and above. I feel like most women thrive. And for some women, it's almost impossible to bring the ferritin levels much higher without ongoing IV drips, you know?
Yeah.
So we want a woman to be iron adequate before labor in case there is blood loss in labor, which will mean, of course, iron loss. Because we really don't want mom to start the postpartum period in a state of anemia, because then her breast milk will be iron depleted, she'll be exhausted, she'll feel dizzy when she stands up, and that really sets the scene for postpartum depression, because they're just exhausted. Like, they start the journey with their baby completely exhausted. So we really don't want that. That's why I like to monitor ferritin in pregnancy and to replenish that iron as we go, which will then also help their immunity in pregnancy and the fourth trimester or the 3 first months postpartum.
Yeah. And I know that you have a very gentle approach. I mean, I see you, or have seen you intermittently since I've been in Singapore as well, because I like that your approach is very gentle and it addresses the easy thing, the easy wins first. And let's look at your nutrition. Is there something that we could change there? And that brings me a little bit to gestational diabetes as well, because I see a lot of this happening at the moment. I mean, we know that diabetes is obviously rampant in Singapore, and it's the major health issue, I think, in this country. So we do see a lot of moms who were born to mothers where gestational diabetes wasn't very well controlled, or they weren't aware of, what sugar levels mean in a pregnancy. And so we see a lot of gestational diabetes diagnoses now. And I would like to see how you help moms with that.
So again, if we can start even before pregnancy with that, it's better. So women who have a diagnosis of PCOS, it in a way falls under the same umbrella as diabetes, in that it has to do with glucose management, and therefore we can influence it with diet. So if we can start that dietary education before pregnancy, it's better, because then my patients with PCOS, they go into pregnancy and they're already doing what they need to do to prevent gestational diabetes. For those who maybe have never had any reason to worry about their diet and somewhere in pregnancy get diagnosed with gestational diabetes, it is something that I find relatively easy to treat with diet and lifestyle. What the doctors will generally do is, if it's been diagnosed, and of course, depending on the severity of it, they will usually encourage women to first work through diet and lifestyle. And if that fails, we'll start using medication. But most of the time, we have pretty good success with basically the tenets of helping glucose management, which is a lower carb diet, avoiding refined carbs, ensuring protein adequacy, working with healthy fats and fiber. It's not that difficult, I would say, especially because it usually hits right later in pregnancy, when women are out of that first trimester nausea, where that's when it's almost impossible to keep them on a healthy diet, because the nausea just really gets in the way. So in that first trimester, we accept that diet will not be perfect. But by the time we have a gestational diabetes diagnosis, usually they're out of that, and we can start working on these fundamentals of glucose management.
Okay, amazing. I'm going to move on, because I know there's lots of moms on the call who actually have small kids, who are no longer pregnant. But I've just been thinking, for a future talk, I would love to talk about PCOS and hormones, and actually all of that, and fertility a little bit more as well. And even on the other side of the spectrum, menopause. And how do you work with these moms? And because I see this all the time now, not just my older moms, it's my friends around me and so on. So I think this
it really starts in the 40s, doesn't it? Yeah.
Absolutely. It starts much earlier now than it ever did. Okay, so moving on to kids. Again, mummies, please, if you have questions, put them in the chat. I have some that were sent in beforehand. Otherwise, we'll just ramble on. So my first question will be, immunity. Why are some kids sicker than others? Do we not all have the same level playing field? What affects lowered immunity in a child?
Yeah, that's a big question. And indeed, I think especially parents, right, who are already trying to follow some of these tenets of natural medicine, and who really pay attention that their kids are on like the most wholesome homemade diet possible. Some of these moms have taken great pains to breastfeed for as long as possible, They've tried at all costs to avoid a C-section to ensure good gut health in their baby and optimal immunity. Especially these first-time parents are sometimes really discouraged and daunted when their young children are continuously falling sick, particularly when babies start daycare or school, right? And often we'll, go into a bit of a guilt trip, like, I've done everything right. Like, how can it be? What am I doing wrong?
Yeah, why me?
Exactly.
Okay.
And it can actually be very stressful, right? To have a kid constantly out of school, or maybe there's an older child going to school and a young baby, and now the young baby gets sick from the older child. Like it's a real big topic. But so, of course, like diet, lifestyle have a big influence on immunity, but there's also genetic predispositions, right? And what the baby comes to the world with, I want to say almost independently of how healthy the pregnancy and delivery may have been. So we know that when a baby is born, they are born with an immature immune system, and they will get a lot of their immune protection through mom's breast milk if they're breastfed. But that immune system takes several years to mature into what our adult immune system is like. So our immune system has been around for a while as adults, has seen a lot of different things, and we've already, in a way, kind of prepared antibodies for most things we may be immune to. So we may have been exposed to. So when we're exposed to it again, our body's like, oh, right, I know this, I'll just make more of these antibodies, and that's that. But to get there, a child actually needs to be exposed and get infected, and that's how the immune system learns. So it is normal for young children to be sick, and it's part of how their immune system develops. So we can't, although we would love that, and it's true, there are a minority of children out there who seem to never fall ill. I mean, it's a bit of a bell curve, right? We have some kids who just seem to have immunity that's just a little more resilient. We have a chunk in the middle who gets sick, on an average number of times, and then we have that tail end who seems to be constantly sick. Now, there are other factors, particularly here in Singapore, that have a big role to play, in that here in the tropics, we seem to deal a lot more, because of the environment around us, with environmental allergies. So again, in children who may have that genetic predisposition, maybe allergies run in the family. So by allergies, we mean allergic rhinitis. So, that constant nasal congestion, like hay fever. We mean eczema, hives, asthma. So if that runs in the family, and the child is predisposed, the Singapore tropical environment will tend to trigger that predisposition. And so children who are mucousy, phlegmy, of course, are going to be much more prone to repeated colds and coughs. And that's perhaps where naturopathic medicine can help to try and offset somewhat that predisposition. In kids who maybe don't have allergies and are getting the usual colds and flus, we can still do things for prevention and to generally try and reduce the course of severity of the illness. So we won't get them to a place where they never get sick, which is every parent's dream. But if we can avoid antibiotics, recurrent antibiotics, if we can avoid them going on steroid puffers, I think that's a realistic expectation.
Yeah, I think that's a really good thing that you said there. It's almost like we see illness as something bad, and I think sometimes we need to reframe it a little bit. It's, my baby has a good immune system. It is fighting something, and the body will learn by it fighting this illness. So as long as we can support them alongside, obviously a kid being ill all the time is a little bit inconvenient for parents, because it means time off work and, things like that. But I think welcoming it as something that makes our kids stronger is a really good way to see it.
And the kind of modern day discourse, this whole thing around we should be really scared of fevers, we should medicate a fever immediately. I don't, for me, that doesn't really work with our naturopathic philosophy, in that we think of a fever as actually the body's response in children to recognizing and fighting the pathogen. Of course, you want to monitor a fever. When a fever goes too high, that's when you want to really take action. But except in rare cases, a fever isn't really something to be afraid of. a fever in a young baby below 4 months old, that's when there is reason to be stressed and to take action.
Yeah.
But your run-of-the-mill fever in an older child, it is just their body fighting infection and doesn't necessarily need to be quashed with paracetamol or ibuprofen the minute it arises, and I also think like bathing parents in this very fear-based approach to run-of-the-mill pediatric illnesses is not doing anyone a favor,
Absolutely. Not to speak of the fact that we know that a lot of the illnesses, especially coughs, colds, and so on, are actually viral in nature. And most often parents with kids that have the flu and the sniffles and so on are given antibiotics when we know that antibiotic resistance is a real thing and is a real problem out there, and we shouldn't be over medicating them. And the reality is often we get out of our doctor's office here with a whole suitcase full of drugs where you think, do I really need this? And often they say, well, you can take it, but it's going to go away on its own. Then why would I put that in my kid's body? I don't know. That's just me.
Yeah, especially there is real research coming out on the effects. We've now had basically 2 generations, right, where antibiotics have been useful, of course, but overprescribed basically. And so we now have data which, of course, shows that antibiotics depletes our good gut bacteria, and we may never fully recover the strains we've lost after a course of antibiotics. Yeah. And also, interestingly, it puts children at risk of having an overweight or obesity issue in their adult years.
Okay.
So there is a place for antibiotics. I don't think any child is gonna, throughout their whole childhood, escape a course or 2 of antibiotics. But here it's more the opposite. We see children who have 6 courses a year of Augmentin, and lots of time, as you said, it's a viral infection, and you could have waited it out for a few days with more supportive therapies. And unfortunately, often too, when these children are given recurrent course of antibiotics, it does seem to weaken their immunity further. Because actually we're not addressing some kind of fundamental building block of immunity. And so we actually want that. We want to be able to take them out of this loop and also educate parents that it's okay to wait it out a little bit longer and educate around real red flags that would necessitate prescription drugs.
Exactly. It's really funny because that's where I come back to the traditional Chinese way of seeing things. And, we should be paying our doctors to keep us healthy rather than to help pay them when our kids are sick. Do you know what I mean? That's a whole different approach. When a doctor looks more at, your nutrition or looking at deficiencies in nutrients and so on, which I guess is what you do. And I think that's the right way to go about it. Anyway, okay, so let me ask some questions that came in earlier on the call so that I know that we have ticked those boxes. So this mom is asking, for phlegm and cough, what are your top remedies when the kids have those respiratory illnesses?
So yeah, when they've reached the stage where they're very phlegmy, and depending on the age of the child, obviously there are different things that we can do, but some of the cornerstone interventions are nasal saline waters, so either the Sterimar spray or the sinus rinse, if the child allows. Because that really, especially young children, they usually either don't know how to blow their nose or don't blow their nose completely and are just constantly swallowing phlegm, right? So it doesn't do anything to reduce that bacterial load. So the nasal saline just gets rid of that excess bacteria and helps clean up the mucosal membrane. So that's something pretty easy to do. I really find steam inhalations very useful too. So if a child is 4 and above, you can do a steam inhalation. Of course, you have to be there with them, right? Because it does involve hot water and so on. Using the classic eucalyptus essential oil is fine. So in a child, you would only put 1 drop in about 1.5 liters of hot water. Or if you have one of these little steaming devices that you plug in, you can also put a drop of essential oil there and have them breathe the steam. In younger children, so 3 and below, I would just
from
do
what age? Yeah,
yeah.
I was just going to say eucalyptus is, and anything camphor containing is a little bit controversial.
Yeah, absolutely.
Yeah.
So in younger children, I recommend more a thyme bath. So you would buy the dried thyme leaves, the culinary ones, and make a strong infusion of thyme, a good amount, a good liter, which you would dilute in their bath water, which you'd make as hot as possible, but still comfortable to them. Close the bathroom door, try to get them to stay in the bathtub at least 10, 15 minutes, breathing in the steam.
Yeah.
So that's very helpful to try and fluidify the phlegm. One of the nice over-the-counter items is also, of course, Flumisil. So Flumisil is N-acetylcysteine, which is actually a sulfur-containing natural substance, which does make the mucus more fluid and sort of therefore easier to cough up or blow their nose. The Flumisil from Guardian does contain like orange flavoring and, you know, other fillers, but it's palatable to children. But if it's an older child, you could also use the supplement NAC and dilute that in water, or if they are old enough to swallow pills, like around 8 and above, they can use that too. And of course, there's homeopathy. So my favorite remedy for a very wet cough where you can really hear the mucus in their lungs rattling around is antimonium tart. So if you have, you know, one of those basic homeopathic remedy kits at home, you could dose them with any potency below 30 a few times a day for a few days in a row and help that cough gradually resolve.
Yeah. So see, that's what I love about naturopathy. There are so many different ways to administer things as well. You know, our kids are not always able or willing to swallow necessarily. So I love your approach of, you know, the inhalation or putting the child in the bath actually for transdermal absorption as well. And I really love that. I wanted to say one thing on the subject of Sterimar, because while I do love my rinses and so on, I feel that spray is really overused. Like I hear a lot of moms using it before they travel. And I want to talk a little bit about this first line of defense that our nose and our mucous membranes actually offer. And drying it out too much, I find, can make it a little bit more harder for the body to fight things off.
Yes. So I don't think it's necessarily something that needs to be done on a daily basis. I would suggest it more in children that are you know, where you can see that mucus production.
You have that phlegm, exactly.
And just help to get rid of the phlegm. Where I recommend the more daily use is in children, usually older children that are very allergic and have proper allergic rhinitis and wake up with that whole phlegm, or my allergic adults. But in a person with generally clear nasal passages, unless there's haze outside, right, or you've had some sort of exposure through inhalation, I don't think it's necessarily necessary. And also, right, we do have a lot of probiotics basically that live in our nasal passages and that strengthen our immunity. So if you're constantly washing them out, you may not be doing yourself a favor.
Yeah, exactly. So knowing when to use it, and this is very much how homeopathy works as well, right? We only use it when we see the symptom that is present. We wouldn't use it preventatively or anything like that. But anyway, a lot to learn for all of you mummies. Sigrid and I are mummies of 3 ourselves, and we were going through this as well, you know, learning what to use in what situation, you know. It is a big learning process for sure. All right, moving on. The next question that we had was about constipation and poop retention in babies. Poop retention is a whole different story because it has this emotional, psychological aspect as well to it. What are your thoughts on that one?
Yeah, so if it's a simple matter of constipation, say in a baby that hasn't yet been potty trained, or maybe an older child that is already potty trained and now has constipation, we can actually get great results with simple dietary interventions, adding in some fiber, a handful of different herbs. Like this is easy to manage. When we're in a situation where it's a child that is learning to be potty trained for bowel movements, there can be a whole psycho-emotional realm to this that make it, I would say, much, much harder to treat. So sometimes it'll be a kind of like a post-trauma in the sense that some children have had their first encounter with constipation, and as they're being potty trained, there's a painful bowel movement. And then they're like, oh, it hurts, I don't want to go to the potty. And it can take a long time to undo that, and often with the use of prescription laxatives, so that children forget that association between pain on defecation, right, and potty training.
Yeah.
Sometimes though, we don't really understand why, right? Some children just refuse the potty and like nothing will do. I would say sometimes here I have used constitutional homeopathy with some success, just because constitutional homeopathy takes into account physical symptoms, but also the psycho-emotional symptoms of the child.
Yeah.
So it can be a nice complementary approach, but often more is required. Like play therapy typically would also be required to try and figure out what is stressing the child out that it has to manifest in this way. And as you know, young children pick up on literally everything, right? So, and they can't articulate it. So if there's marital stress, you know, if there's some other conflict in the family, if they've relocated, birth of a new brother or sister, I mean, right? That's where the play therapy and perhaps the constitutional homeopathy can be helpful, but it's a tricky one. It's tricky for parents too, who are typically at their wits' end with this.
Yes, I can imagine. Because you mentioned it, I don't think that everybody on the call is necessarily aware of what constitutional versus acute homeopathy is. Can you talk a little bit about that?
So acute homeopathy is, I think, what most people are possibly familiar with, where basically we just look at basic physical symptoms and then try to match them with a remedy, often in a homeopathic first aid kit. So the classic is, oh, my child fell down, has a huge bruise, let's use arnica. I think that's probably the most famous one. Or my child is cranky and teething, has, you know, red cheeks, is angry, let's use chamomilla. Right? Like we have a lot of very famous big homeopathic remedies, and it's a kind of like a superficial or very physical symptom-based way of treating. It's very useful, of course. But homeopathy, when we call it constitutional homeopathy, is more of looking in more detail at the emotional picture that the patient is in. So we would look at the emotional side and the physical side, and then prescribe a remedy that's usually very specific, often not found in your classic first aid kit. Often we have to special order it. And we're hoping that the remedy helps move the whole emotional and physical picture forward over time, but it's usually over months. A bit like psychotherapy, we're trying to make things move over a period of months to years. But we do use that approach in children, and often children see faster results compared to adults. I think because they're a bit less complex, they have less going on. We can kind of classify them in different emotional categories, whereas with adults, right, there's so much going on. We have our whole history, negative experiences, biases, and so on. Yeah.
Okay. Yeah, interesting. That's like a challenging thing. All right, moving on. When kids are sick and they have no appetite, what is your top recommendations as to what to give them? Obviously, we want to keep them hydrated, but what are other tricks to get them, like, to keep their nutrition up?
Yeah, so it is normal for a child who is sick, particularly a child with fever, for their appetite to drop significantly. And in a young child, it's true, it can be a bit scary in that they can easily lose a kilo, you know, in a few days. And I think as a mom, there's nothing worse than seeing your kind of chubby baby, you know, lose some weight. So there are a few different things. If a child has an acute stomach flu and is vomiting a lot and not keeping anything down, particularly if they also have diarrhea or fever, that's where hydration is absolutely crucial to prevent them from ending up at the hospital on an IV drip. I think a lot of people have this misconception that hydration is drinking water, but hydration is basically fluids and electrolytes as well, which are basically ions that float around in our bloodstream and are crucial for our cellular functioning. So in a child that is vomiting frequently and so on, I do find electrolytes of great value. So your basic electrolyte sachets from Guardian, which you would dilute and feed them a teaspoon at a time every 10 or 15 minutes.
Okay.
If that stays down, the next day you can move them to any sort of broth or clear soup, like chicken soup, vegetable soup that they can tolerate, and herbal teas, any herbal tea that they like. Children like licorice tea, chamomile tea,
Yeah.
elderberry, any of those is also quite hydrating. A lot of people like to use rice water as well, which has a lot of electrolytes and starch. You can use that too.
I never used,
Yeah.
never heard of that. Yeah.
Yeah, so that's an easy thing. Everyone has rice at home and you just use the rice water to rehydrate them. But I would say if you have access to the electrolytes, right, from the pharmacy, they're just more studied, balanced, etc.
Yeah.
So that's a child with like acute stomach flu who really can't take any food, is just throwing everything up, including water. And in those, we can also use phosphorus, the homeopathic remedy, quite well known for that. Now, if we're talking more of a child who, say, has a cold or a flu and has a fever and isn't eating much, I would suggest avoiding any kind of raw vegetable during that time, and stick to hydrating fruits like watermelon, apple could work. Usually children will still be interested in that, if nothing else. You can also resort to diluted juices at that time, right? Which generally we don't really recommend fruit juice in children, but that would be a bit of an exception.
Yeah.
And anything well cooked, right? So, well cooked rice porridge or oat porridge with some vegetables and well cooked chicken could be an example. But, it is normal for them to have significantly reduced appetite. So, as long as they're taking a little bit down, they're urinating normally, right? I wouldn't worry too much if they had 3 to 5 days of reduced appetite.
Yeah.
That is also how they themselves are helping their immunity, because it's busy. We're using our vital energy to fight the pathogen, so not digest our food.
Yeah.
Usually also children will naturally, once they feel better, make up for all the calories they missed, and we'll have a few days where they're properly hungry.
Okay.
Right? So in those cases, I would just try to do the minimum, so they have some food, obviously, but I wouldn't worry too much if they're not eating well. That's just part of illness.
Another thing that I found useful is to make my own popsicles.
Oh yeah.
With fruit and yogurt or something like that. And then they found it easier to suck because it doesn't fill the stomach up so quickly, and they managed to keep that down. So
yeah, that's a
trick.
good trick. Yeah, especially as a mom, then they have something there to maintain their blood sugar levels. They have some calories going in. So definitely great trick.
Exactly. Got a question in the chat there. Good morning, Sigrid. What can we do on a daily basis to support the immunity of our children, knowing that the diet is relatively healthy? Would you recommend probiotics, vitamins, zinc? What are your go-to remedies for that?
Yeah, I think most kids can use being on a small vitamin D supplement without a blood test, right? For most children, when they're doing relatively well, we would suggest doing a blood draw. So I would put them on a sort of basic amount of vitamin D, depending on their age. I think it's useful to have a multivitamin with some zinc in there and vitamin C, just because they're such huge immune nutrients. And possibly with some vitamin A as well, or a beta carotene vitamin. So that would be, the backbone, some kind of multivitamin that would cover most of these things. Just watch out, because a lot of multivitamins out there are just not very good. Like they're not very concentrated.
I'm about to ask you that. So what can we find in Singapore that is not, I mean, you find so many different things that I think is just, there's a lot of stuff on the label saying what it does, but whether it actually does anything, we don't know. The quality is not there. So do you recommend any of these vitamin gummies and whatever? What is your...
Yeah, so often in young children, we don't really have a choice where we have to go to a chewable tablet or a gummy, both of which will have some sugar content, but that's just unavoidable because these kids can't swallow pills yet. And, if it's not palatable, it's a nightmare for everyone to keep them on the multi. So I think that's okay. to have it there, as long as obviously the rest of the diet is reasonable in terms of sugar.
And are there brands that you rate over others?
Yeah, so I like to recommend things on iHerb because they usually have better brand choices than what's available at the pharmacy, and also it's more cost effective. So in terms of kids multis, I like the Smarty Pants brand. They have quite a few, they have a few different lines. It's a gummy, like a kind of it's not exactly a gummy, it's like a chewy gummy, let's call it that. I also find what's it called? Kids Alive. I think it's called Kids Alive.
Okay.
Is pretty good also. These are usually chewable tablets. Yeah, it's the Nature's Way Alive for kids. That's what it's called.
Nature's Way.
Yeah, the Kids Alive.
I'll put those in the comments later. So
yeah, those are not bad. Those are not bad. And sometimes
can you make your own?
Like if you have individual
fruit juice, gelatin, and you add your vitamin C powder and zinc?
Oh, yeah, you could do that, of course, right? If you know how to, a lot of moms will make like homemade gummy bears, right? With like collagen and other things. So you just have to know the amounts of different things you want to put in there. And that depends on your child's age and weight. And also some kids are picky. Like I know I've tried to do that with my kids, and although they love gummy bears, they never loved any of my homemade gummies. So I gave up pretty quickly. But technically you could, yeah.
Okay. So zinc, vitamins, multivitamins. How about probiotics? So probiotics, obviously, we know that we have different strains that work for different microbiomes, whether it's the mouth or the vagina or the digestive tract and so on. So for our little people, what are the strains that we should be looking out for? What are the more potent brands that are out there? Is there anything in Singapore? Is there anything they can order online?
Yeah, so probiotics, I mean, we throw this term around, right? Probiotics, but as we've had more and more technology to study the microbiome, it's actually a very complex theme. It's definitely not as easy as we once thought. And there is now a big push towards, for example, what is different in the flora of people with allergies versus people without allergies. And of course, there's strain difference between these two. Yeah. And so some brands now are saying, oh, okay, people without allergies have these strains. So let's put together a supplement with these strains to help that microbiome. Yeah. So for kids with tendencies towards allergies, allergic rhinitis, asthma, things like that, there are brands that put different strains together. I like the brand Hyperbiotics on iHerb, and they have one that is their ENT line, which I have found pretty good to support that bacterial flora in the nasal and sinus passages, and it's chewable, so it's useful. And also now with strains, we used to say like bifidus or lactobacillus, and then we had lactobacillus, for example, reuteri or casei. But now we're even beyond that, where there's numbers behind the strain. I know. And that's a substrain, and that's actually to replicate what's found in research. So that hyperbiotic ENT uses the substrain, which actually most brands don't do. So I found it quite nice to use that. But again, that's more for children who suffer from allergies. Yeah. And we want to support that microbiome. Otherwise, in children that are generally well, and what we are trying to do now is more support the generally speaking.
Yeah.
I still recommend a slightly older approach, which is we know that a healthy microbiome basically has a lot of strain diversity. That seems to be the key to health, because they study all sorts of conditions, right? Like people with IBS, people with allergies, people with endometriosis. And in all of these conditions, the common point is they have reduced strain diversity in their own different way each, but that's the key thing. Okay. So the approach is, okay, so maybe if we use as many strains as possible in different products, we will eventually give the body at some point the strain it needs. So that's the general approach, I would say. So I try to look for probiotics, except in certain situations that are multi-strained. Yeah. Although some brands for kids, they will only pick like one one type of strain that seems to be important in children. So for example, like I like to use Nordic Naturals. They have a probiotic for kids, and all they would do is put a certain type of bacillus in there. So sometimes I would use that, but otherwise I try to use more of a multi-strain type of product. And then sometimes I'd even use an actual powder product, like, you know, a capsule with powder that's actually marketed for adults, but we use just a smaller dosage for children. Exactly.
I actually like the Gyrodophilus brand.
Yeah, I've used that a lot too.
Yeah, because the adult the capsules are heat stable and all of that, so it doesn't suffer in the transport and things like that. I was going to ask you something else that I've now forgotten. Is there a point in circling your probiotics and after, I don't know, 3 months, use a different product?
I think, yeah, because unless you're specifically using a single strain probiotic for a reason, right? Like, oh, I have allergies, I just want to use this. I have UTIs, I'm just using that. If you're using this more umbrella approach with multi-strains, I think it makes sense to rotate, because different brands will pick and choose info from research and decide, okay, we're putting these 10 strains. But the next brand, which is possibly also a good brand, is using 10 other strains. So I would say if you're well or your child is well and it's more about general support, I would rotate them, you know, just go through one bottle for a couple of months of one and then switch to the next thing, or take a break and then switch to another one. And the idea is, again, to expose your body to as much strain diversity as possible.
Interesting. I love that. And then going back to food, because I think,
of course,
you know, our prebiotics and probiotics that we find in food, we mustn't underestimate that. And, you know, I find that many cultures have their own specific foods, and whether that is a, you know, the dosa batter in China, in Indian food that is fermented, or a ton of fermented grains, or it's the sauerkraut that is more, you know, Central European and so on. Or the Japanese have beautiful fermented vegetables as well. Kombucha, kefir, and all of these things can be really, really good too.
Yeah, and I mean, ideally, right, we wouldn't need, right, to resort to pills and so on, but there's a couple of things. The first one is that when we take a probiotic from a pill, it's just passing in our digestive system, and actually only a minority of those, if we're lucky, will ever take up residence in our gut, which is what we want. And it will take up residence if there's also the right fiber in there, which ideally should come from our diet, so prebiotics. So for example, like cabbage is a great prebiotic, and that's why it turns into sauerkraut, or kimchi, right? Or milk provides a whole bunch of prebiotics, which turn to yogurt and then cheese, and right, like all of the classical fermented foods in most cultures. Somehow the world figured out, oh, cucumbers pickle nicely, or right. So ideally in our diet, we would want to have enough of these fibers and prebiotics to support the right gut flora. But we've kind of dug ourselves into a hole in that we now know that a lot, this is going to be a bit depressing, but just like, you know, whales are going extinct, or koalas or whatnot, we know that a lot of our bacterial strains in the soil have gone or are going extinct because of basically environmental pollution, and also the sort of steadfast use of antibiotics, both for us, but also in the way we raise cattle. So their manure is contaminated with probiotics, with antibiotics, and then it kills organisms in the soil, which means that today, even if, say, you consume a high vegetable diet, it still doesn't contain the same strains, soil strains necessarily, as 200 years ago.
Okay.
And it's come to a point that now there are large research projects where they're trying to literally collect stool from all sorts of civilizations that are still around today, like primitive cultures, because their stool still contains strains that have otherwise gone extinct in the developed world. So that's where we have limits with diet, where sometimes, you know, a person may be on a great diet, but will still require probiotics. And then sometimes I see the other extreme, where we have been a modern day human being with probably some defects in our bacterial flora, and people will read up about kombucha or something, and they'll start this marathon of fermented foods and then end up with like feeling very bloated, gassy, yeast infections. So that can be possible too, that you can't go like with that imbalance that we all probably have and then just throw tons of fermented foods at it. There's kind of a method to doing it for the other strains to accept that change and to finally optimize our gut health.
Interesting.
So it's not as straightforward as we'd like it to be, but probably small amounts of fermented foods here and there are a good idea to kind of make it short.
Yeah, because I think it also, really supports your digestive system. A lot of people have issues, just breaking food down these days as well.
Yeah.
I totally take your point. There's so much research out there now, and it's difficult to see the wood for the trees. The trees, there's
the forest through the trees.
You know what I'm trying to say.
Yeah.
So, it's good to work with a specialist, obviously, who keeps on top of the research. And I think that's what you do to help to individualize and tailor make the whole thing, right? Because that's the point. We talk about certain things and ideas and approaches in these calls, but ultimately it's all about looking holistically about what is this person all about, or your kid, and what is going on in their systems, and how can we best support this. And one solution will not be the same for the next person. Okay, mummies, we have some more time if there are other questions on the call. Or absolutely, if you want to speak to Sigrid directly, I'd be happy for you to raise your hand, or we'll make this happen. It's getting a little bit loud in the background. I think my lunch is being prepared. In the meantime, because we talked about climate, is that often, an issue with when kids are often sick and they have all this congestion going on, there could be another aspect, which is, exposure to mold, and depending on where you live. And this is obviously very much a Singapore issue with high humidity and so on. Can you talk a little bit about that, maybe?
That's a huge topic, actually, both in adults and children. So often when we have a child that has had recurrent colds and flus, right, who is maybe in the cycle with antibiotics, and, maybe now they have a constant runny nose, even in between infections. Maybe parents are noticing like these dark circles under their eyes and mouth breathing. So very often there will be an allergic component. And so the two more common ones that we see here in terms of environmental allergens, one is the tropical dust mites. So anything to reduce dust mite exposure is going to be helpful. And the other big one is mold. So of course, here, hot, high humidity environment just makes it easy for mold to grow. And I think in our minds, we think of mold as these black or blue spots in our bathroom, right?
Not always visible.
In Singapore, exactly, we have a lot of white mold. So, you can have a white wall like the one behind me, and it could actually be full of mold. So if someone in the family has this kind of picture, possibly more people in the family, in adults, mold exposure doesn't always have nasal symptoms. It can also contribute to like brain fog, fatigue, like quite significantly. You could get a mold assessment company to come and take a look in your home, and usually they will show you. And actually, once you've seen it, then you learn to recognize it. Yeah. And to deal with it. And I learned about this when I moved to Singapore 15 years ago, where I thought, oh my God, I think we're having a mold problem. And I was like, I can't see it. And, we had a mold assessment come in our house. And in fact, like there was white mold in a lot of the kids' bedroom, to my horror, So then once you've seen it and the areas in your house that require a bit more work in terms of special cleaning products, more ventilation, you can keep it more at bay. I mean, there's no such thing as zero mold spore exposure here in this climate, but the load really makes a difference. Like, does it overwhelm your immune system, or is your body able to deal with it in a relatively symptom-free kind of way? That will contribute in children to their adenoids or their tonsils enlarging. And again, that whole ENT picture that they're faced with.
Exactly. And that's why I wanted to mention it, because often there's moms are a little bit at a loss of what to do now. They've tried everything and still their kids are not getting over this. And it might actually be an environmental factor.
Yeah, absolutely. Or if you have a pet, sometimes there's a pet allergy in these children, which is of course a little bit heart-wrenching. But mold is a big deal. Like unless the mold is removed, the picture just won't improve despite what you do. And that's where you start thinking there must be some mold issue. If literally everything else has been tried at this point and it's still not improving.
Mm-hmm. Okay, and then you do testing. We had a question the other day in the group where they said that at your clinic they don't test kids under 12. Is that correct? Or
so yeah, so where I work is an integrative clinic. So there are GPs and there's a gastroenterologist and dietitians and so on. And they don't want this to be, pediatric practice. And also our staff isn't specialized to do blood draws in younger people.
Okay. Mm-hmm.
So the staff won't do a blood draw, except some exceptions at times. But generally speaking, if you need a blood draw, we would send you elsewhere, like back to your GP or pediatrician. And we will do blood draws on 12 and above populations. However, if we're looking at a functional test, like a stool test, a urine test, right, to look at other things like nutritional status, mold exposure, these are tests that, you collect a sample at home and then we send it to specialized labs abroad. So that's not really an issue for our functional test. We use them on children all the time.
I see. Okay, that's really good to know, because there seemed to be some miscommunication there, and I just wanted to clarify that. So basically get in touch with you as well rather than the front.
Yeah, exactly, because they have, our general line. But then, I've worked before with children, say an 8 or a 9-year-old that had food intolerances. We thought, let's do the blood draw for food intolerances. And then on a kind of one-by-one basis, we can do them at times. Yeah.
Yeah. Okay, amazing. And then just quickly, because, as you mentioned, so many different modalities, and that's the beauty, I think, of naturopathy, that we have not only herbs or not only supplements, there's a wide spectrum of things that you use. So what are the modalities that you use mainly with your pregnant women and with your kids?
Yeah, I think nutrition, I think there isn't one case, except maybe my stress and burnout cases, where I almost always go back to nutrition. And then I think I still do use quite a lot of supplements and botanical medicine. I think that's probably my top couple, also because generally people want that, like they're wondering what can I take, like, and it's easier to recommend that than a hydrotherapy treatment, for example.
Yeah. Okay, well, that's good to know. And then you are to be found at Tucker Health.
That's right.
And so in Novena, very conveniently located. We'll post all your details under the video as well, because I know we have had so many moms who said, oh, I'm at work, but I really want to, listen into this talk. So we'll be sharing the video later. And I'd be happy for you to share it as well on wherever you want with clients and so on, if that's useful, you think. And so all that remains to be said is thank you. I really appreciated having you on the call. We did hear some hacking, but it wasn't too bad.
Not too bad, right? I don't think it's in the terrible type yet. So good, we were lucky.
Absolutely. But, if you don't mind, I'd love a deep dive into hormones at some point, whether it's fertility or...
Oh, sure. That's such a big topic too. Lots to be said about that. But thank you for having me. I hope this was useful to the participants today. And wishing you all then a good rest of the day.
Amazing. Have a lovely week. All of you mummies on the call as well. Okay, bye-bye.
Bye.